important one today. We've worked on it long and hard. For years, they've been working on it. And I see Kevin's in the audience, and I just want to thank you. You were fantastic on television today. I actually want to keep you where you are, if you want to know the truth. Kevin Hassett is so good. I'm saying, wait a minute. If I move them, these Fed guys, certainly the one we have now, they don't talk much. I would lose you. It's a serious concern to me. So I just want to say thank you very much. You've done incredible. We don't want to lose him, Susie. But we'll see how it all works out, okay? Thank you, Kevin. Great job. And thank you for all being here as we discuss the largest investment in rural health care in American history. This is the big one. We're delighted to be joined by many incredible members of the healthcare community, including doctors, nurses, and pharmacists from all across America. We're also very happy to have with us some very talented people. A man who is really good at this, extremely non-controversial, which is, I wanted somebody non-controversial. So I chose Robert F. Kennedy, Jr. to head the whole shebang up. And he also happens to be a great guy. Brooke Rollins, who's doing a fantastic job at agriculture, and thank you. And how are the prices coming?
They're coming, sir, they're coming down.
Don't forget, we inherited a mess.
We sure did.
Remember eggs? They were up 4 times higher than they ever were. And in my first day, they said, what are you going to do about eggs? I said, I didn't cause the problem. We didn't cause, we inherited a mess, but the prices are coming down.
Yes, sir. Wholesale prices are down 86%. Retail a little bit less than that, but yes, you're making America affordable again.
With you in charge, I have no doubt, and I appreciate it. Thank you.
Thank you.
And administrator for the Centers for Medicare and Medicaid Services, a really good man, a really brilliant guy, Dr. Mehmet Oz. Thank you very much. Thank you, Dr. Oz. And thank you also to Governor Jim Pillen, Senator Dan Sullivan, and Representatives Rob Bresnahan, Mike Lawler, John McGuire, and Nick Begich. Thank you all for being here. Appreciate it very much. Now, we have other congressmen here, I see, and a couple of senators, and we appreciate everybody being here. Everyone wants to be a part of this. It's so important. It's maybe, I don't know, for many people, there's nothing more important. I would say maybe defense. You know, we need defense, and we need offense, too, by the way. As part of the great, big, beautiful bill, we're increased, and we have increased funding for the health care by an unprecedented $50 billion. That's rural health care. Nobody thought that was going to happen, and we got it done. So we have rural health care for those that were trying to make a case that we weren't taking care of the rural community. I'm all about the rural community. We won the rural communities by numbers that nobody's ever won them before, and we're taking care of those great people. So we already did this. We increased funding for rural health care by an unprecedented, record-setting $50 billion over 5 years, which will benefit Americans in all 50 states. And this made possible and was made possible by cutting massive waste, fraud, and abuse from Medicaid and reinvesting those funds to revitalize hospitals and our cherished rural communities and hospitals in rural communities. And I want to say, with all of the fraud that we're seeing in Minnesota and California and other places, I actually think that if we do an unbelievable job, you could almost balance your budget, Kevin. If you take a look at the kind of numbers you're talking about, nobody ever saw anything like it. They're all corrupt politicians, from the governor of Minnesota to the governor of California to everybody. They're just corrupt politicians. And you're talking about hundreds of billions of dollars in fraud, waste fraud and abuse. But in fraud, you're talking about hundreds of billions of dollars. Under the Unaffordable Care Act, which is Obamacare, it's called the unaffordable. It is unaffordable, remember that. Rural hospitals and communities were devastated by soaring costs, and that continues. Despite colossal increases in government spending since Obamacare was passed, only 7% of the annual Medicaid spending on rural hospitals has gone to rural hospitals. So there's only a very little. They didn't care. Obama didn't care about the rural community, to be totally blunt. What he did care about is insurance companies. And this was a bill to make insurance companies wealthy. And they did. They made insurance companies very wealthy. I would say they don't like me too much. because they spent hundreds of billions of dollars, and we're going to have that money spent to the people and given to the people, not we're going to circumvent the insurance companies. Partially as a result, rural health care facilities have suffered from low occupancy rates, workforce shortages, and failing programs that put Band-Aids, literally put Band-Aids over the problems in those communities, and we're not going to have that. We're taking great care of them. With the Rural Health Transformation Program, we are getting rural communities the health support they need, and we're getting it immediately. These funds will go to empowering rural hospitals, strengthening their workforce, modernizing facilities and technology, and ensuring that rural Americans get world-class health care in their own community, right smack in their own community, like they've never had it before, and they've been hurt very badly by the Unaffordable Care Act. Every single Democrat in Congress voted against the lifeline for rural communities, and I hope everyone knows this, and this is not about elections, but I hope you remember this in the midterms, because the Democrats are just so horrible toward the rural community. But I want to take a moment to thank the incredible House and Senate Republicans who worked so hard on making this historic investment possible. That's what they did, and they did work hard. I don't think, got a Democrat vote, did we? Did we get one Democrat vote? We got all Republican votes. It was an amazing feat, and I want to thank Mike, our Speaker of the House, Mike Johnson, and John Thune for really doing a great job. It was tough. You know, we have small majorities, and I want to thank the congressmen that are here for doing, in particular, for working so hard and getting this done. Yesterday, I also announced our framework to lower health care prices for all Americans, including those in rural America. And we're calling it the Great Health Care Plan. You know, we had to come up with a name, and everybody wanted to say, oh, well, can we put something about lowering costs, because we're lowering costs very substantially. So I had Bobby, and I had Oz. We had everybody in there. We had a whole group of people, and we're trying to come up with, so we're saying, the cost reduction plan that gives you good health care. And I said, it's too long. It's not going to sell. I said, we had more plans. And they wanted to get the words cost reduction in there, Laura, especially you. They wanted cost reduction in, and then they wanted great health care in. I said, look, you can have one or the other, but it gets too long. We're talking about the name of a plan. So we got it down to 7 or 8 words, and which is far too long. Nobody can remember that much. And I said, how about just call it, because this is the Great Health Care Plan. Now, a great plan has to be cost-effective, otherwise it can't be a great plan. That's the way I looked at it. So we have a very glamorous name. It's called the Great Health Care Plan, not the Unaffordable Care Act. I don't like that name. This is called officially the Great Health Care Plan. That means low price and great health care. So you're going to have, at a lower price, great health care. First, our proposal codifies the massive discounts on prescription drugs that my administration is achieving through our most favored nation provisions. Okay, we can go into this. We can go into this for hours, but the bottom line is we'll be paying the lowest price of any nation in the world. Whoever's paying the lowest, we match it. This could have been done years ago. I was going to do it in my first administration, but when COVID came toward the end, I said, I can't believe it wasn't exactly a good time to be doing it. But I said, why isn't somebody doing it? And the reason they're not doing it is that no other nation would agree. France, as an example, paid 10% of what we paid. Germany was paying 13 or 14% what we paid. In other words, we paid many times more, not a little bit more, not 10% more, 10 times more. A pill would cost 10 times more in New York than it would cost in London, as an example, than it would cost in Munich. And this went on for many decades. This was right from the beginning. And the reason it went on was a little bit of the healthcare companies, but it was other nations. And I understand that. If I were heading Germany, I'm not going to double and triple and quadruple my healthcare. They got the healthcare companies to pay. It just took place over a long period of time, got worse and worse. And it just, hit numbers that were just absolutely unsaleable. And if you remember, the doctors in the audience remember, they said, well, we have to do research and development. I said, well, what about research and development for Germany? Well, we've decided to put up so the pill would cost 5 times more because of research and development, and 5 times more for other reasons. They had all these phony reasons. And finally, I said to the healthcare companies, we can't do it anymore. We can't do it. And it started, really, I tell the story. It wasn't meant to be funny. People find it funny. But a friend of mine who's a very smart guy, very, very rich, very powerful man, actually, but he was very fat. And he took the fat, I call it the fat drug. I won't give you which one. It was Ozempic. I won't tell you that. And he went to London on one of his many business trips. It's all he does is business. He can't walk across the street, but he's a great businessman. And he said, President, President. I said, what? He used to call me Donnie. Now he calls me President. So I said, you've come a long way. He goes, but I have a problem. What's your problem? In New York, I pay $1,300 for this drug. Now, this means nothing to him. This is like a penny out of your wallet. The guy's worth hundreds of millions, billions of dollars. He said, and in London, sir, I pay just a fraction of that. I said, what are you paying? $87. I said, well, is it the same drug? I knew exactly what he was getting at because it bothered me for a long time. He said, it's the exact same drug.